So today's topic may ruffle a few feathers, but it is so needed. When I asked my community what topics you all wanted to hear about, one of the most requested was what about fertility friendly workouts? We hear so many different things when it comes to women's workout routines or workout routines in general and what that should look like. And today we're going to dive into it from my lens as a holistic women's health physical therapist who also has my exercise physiology bachelor's of science. So I have done a huge deep dive into the literature when it comes to exercise and how that supports or does not support our hormones as women, particularly in the reproductive years. So, in our 20s, 30s, and even early 40s, what does an optimal workout routine look like? So I'm not here to fearmonger or tell you to give up the workouts you love. You need to do what you enjoy. But I am here to help you understand the difference between what's popular and what's actually supportive for your hormones, your fertility, and your longevity, your long term health. Now, why does this conversation even matter? Women in their 20s, 30s, and early 40s are often trying to conceive or planning to do so soon, navigating hormonal shifts such as PMS, PCOS, or irregular cycles. We're often recovering from birth or preventing burnout or navigating the constant changes of having small children that we are raising. And we're often living with stress. So, this may show up as adrenal issues or an overtaxed nervous system or recurrent fatigue and struggling with energy levels. So, these are common things that I hear in the office from my own clients. And fitness really does play a role in this. So, what do we hear when we go into the gym or when we look at a fitness influencer on Instagram? The advice we often hear is to go harder, to do more cardio to lose weight, to never skip a day or you will fall off track and not build the habits towards sustainable health, right? So it's as if our bodies are this machine and it needs to do the same thing every single day of the month. But the truth is, our hormones as females change from week to week. And your workout routine needs to be able to adjust to support that and not deplete you further. Now, I am not saying that we need to sync all of our workouts with our cycle. There is not enough research to specifically pinpoint that yet. However, we do need to develop a foundational workout routine that supports our body as females. Most exercise physiology research on performance and longevity and muscle mass is done on males. And then that is extrapolated to us as females to mean the same thing. When in reality, with our hormones adjusting from week to week, we need to look at the female body differently. We cannot extrapolate the training profiles for our male counterparts to us as women, as our body's needs are highly unique. And that's exactly what we're diving into today. So, we're going to take some hot takes on popular workouts and my thoughts on them as a holistically minded orthopedic and pelvic health physical therapist. I am 33, so I'm also right in the middle of those childbearing years. I have three children of my own. My youngest is about 18 months. So, just went through that pregnancy, breastfeeding, and postpartum season myself as well. So let's talk running. Running is a popular workout that so many love to do, and personally is a love of mine as well. I ran cross country and track in high school. And then in college, I ran a dozen half marathons and even a full marathon. So I certainly am not anti running, but I am anti overdoing it in the name of health. So, excessive long distance running can increase cortisol, that stress response hormone. Excessive long distance running can suppress ovulation. So, that is when our egg is released to signal that fertility every month. and it can lead to energy deficiency. So, this is now known as REDS, or relative energy deficiency in sport. Now, this condition is characterized by insufficient energy intake to support the energy demands of training and daily life in athletes. And by athletes, I mean anybody who is active. So, you and I, those of us who are enjoying staying active throughout our lifespan, not just those who are specifically on an athletic team. So, this energy deficiency can lead to various health and performance issues, including menstrual dysfunction, bone loss, impaired immune function, reduced metabolism, and difficulty maintaining energy levels. The potential for heart rhythm abnormalities and other cardiovascular problems. Now, REDS also has performance effects. So, this is the opposite of what anyone wants, right? When we are exercising, we are always wanting to better ourselves. We are wanting to get a faster time in our half marathon or our 5K. We are wanting to lift a heavier weight. But what happens in this relative energy deficiency syndrome, or when we are overdoing it, especially from a cardio standpoint, is that the opposite actually happens. This includes decreased strength because our muscles don't have the energy that it needs to build stronger. So we actually see a reduction in strength, a reduction in endurance, and a reduction in the overall athletic ability of the individual. So, REDS was formerly referred to as the female athlete triad, but this term has expanded to recognize that the condition can actually affect males as well, and that it is more than just the three-part model of the female athlete triad. And as I just mentioned, there are a number of layers that this can unfold within, including performance deficits, right? So if you are somebody who likes to run 6 days out of the week, or goodness, every day of the week, I really encourage you to dial it back. I'm not saying to stop running, but I highly recommend doing alternating days. So, for instance, maybe Monday, Wednesday, and Friday are your impact days. Those are your running days, or maybe it's cycling, whatever form of cardio you really enjoy. And then the other days of the week, you're factoring in more low impact exercises so that we are not having this huge relative energy deficiency on our body. Now, everybody is different when it comes to what our body can handle in terms of output. So, signs that running may not be serving you, or that you're doing too much running or for too long or at too high of an intensity for your body, would be the loss of a menstrual cycle. So, if you have an irregular cycle, definitely look at if running might be a part of this. I know for me personally, it definitely was. I was running 6 days out of the week since probably 12 years old. And when I got in college was the first time I dialed that back, So then I saw that restoration of my menstrual cycle, and there were other factors at play, of course, but running can be a huge factor because of the amount of breakdown of our muscle and our fat and all of that, and then the building blocks needed to repair. So if it is not serving you, you will notice a loss of your period or an irregular period, fatigue, you just feel tired all the time, slow recovery, you'll see multiple injuries, stress fractures can be a huge one, or tendinopathies, and then trouble conceiving. So, running in moderation, especially if paired with strength training and recovery days, can be absolutely fine, but it should not be your only form of movement. And I highly recommend alternating days, as I mentioned, so that we are spreading out the impact on our body. Next hot take is on high intensity interval training. So, HIIT workouts have become the go to for quick, sweaty workouts. So, think of your quick 20-minute, super high intensity, you are drenched in sweat, heart rate is really high type of workout. Now, this can be great for getting it in really quick and feeling a really good stress relief. But for women with hormone imbalance, adrenal fatigue, so that would be struggling with like a thyroid issue, or if you're having fertility struggles, high intensity interval training can oftentimes be too much. So, high output with little recovery times is a lot of stress on your system all at once. Now, this can lead to increased inflammation because of the quick amount of breakdown of those muscle fibers that aren't having time to rebuild and repair right away. So, this can lead to increased inflammation, poor sleep. We really need that sleep for our recovery, and then cycle irregularities. So, my hot take on HIIT training is that it is great to cycle in occasionally, certainly not daily. So, similar to running, where this can be just a huge amount of output in our body and not enough time for recovery. So, ideally, we would avoid HIIT training during the luteal phase of our cycle. So, this would be that second half of your menstrual cycle, or if you're trying to conceive. As a reminder, the luteal phase is the second half of your menstrual cycle after ovulation, and it's just before menstruation. So, that is that phase of our cycle that if an egg is going to fertilize, it would do so during the luteal phase and implant, and then we shift into pregnancy mode versus shedding of the lining for another menstrual cycle. And so that's why, particularly if you're trying to conceive, I would avoid the high intensity interval training workouts during that time frame, as it can be too much stress on the system. There also has been specific research indicating that HIIT and high intensity workouts in general for women in their childbearing years increases risk of miscarriage. And for that reason, if you are trying to conceive, I suggest staying in the moderate to low intensity training ranges. If you feel the need for high intensity bursts for a stress outlet, I totally get it. I would program this in during the first half of your menstrual cycle then. So if you feel up to it when you are menstruating, great. Or, at that time of ovulation, that would be a good time to get that big energy burst out, any kind of stress relief. That way, we are more so calming the nervous system whenever we are in that implantation phase. Also, if high intensity interval training is something that feels really good for you from a stress management standpoint, similar to running, then let's cycle it in, but on alternating days. So, again, maybe Monday, Wednesday, Friday are your higher, moderate to high intensity days where you get a higher sweat and a good stress relief. And then we're doing more low impact work Tuesday, Thursday, Saturday. Now, a hot take on strength training. So, strength training has gotten a lot of attention lately, and for good reason. I really would say that when it comes to women in their reproductive years and beyond, as we move into perimenopause and menopause, strength training truly is the gold standard. It is something that every single person will benefit from. Now, why? Strength training supports our muscle mass. So, your muscle mass, we are talking about the actual fibers, the number of fibers we have within that muscle, and then the diameter of those muscles. So, how strong those muscles are and their tone. Strength training also supports bone density. So, this is something we often don't think about, but by putting resistance through our bones, through your skeleton, you're actually building the strength of that bone. And so this reduces your risk of having a fracture if you fall or getting a stress fracture from running, impact training. So strength training is actually going to improve the strength of not only your muscles, but also your bones. It also improves our insulin sensitivity. So there's been a lot of research lately about blood sugar regulation and blood sugar balance. And the more muscle mass we have, the better job our body does regulating our insulin or our blood sugar. And then finally, hormone production. So strength training and supporting the muscles will actually also support your hormones. And this includes that progesterone hormone, that progestation or pro-pregnancy, which is a key indicator of health during these childbearing years, whether you're seeking to bear a child or not, because biologically, that is what our bodies were created for in these 20s, 30s, potentially early 40s, right? And so we want to support the hormones that are naturally needed for us to thrive in these life seasons. Now, strength training will also improve your pelvic floor and core function when done mindfully. I was recently doing a workshop with a group of ladies, and I told them truly any exercise can be made into a pelvic floor exercise. I pretty much never prescribe Kegels, which are just that straight contraction of the pelvic floor. Rather, I am implementing pelvic floor contraction and relaxation with full body movements such as lunges, squats, hip hinges, deadlifts, single leg RDLs, goodness, lat pull downs, rows. All of these exercises can incorporate your pelvic floor and your deep core, which for women of childbearing years these are key areas that we need to not only support proactively, so preconception and during pregnancy, but also then rehab or repair postpartum so that we can feel really good in these years, but also as we age from a longevity standpoint. Now, I would recommend aiming for 2 to 3 days a week of full body strength training. Now, this is if you're doing strength training in addition to, for instance, running or the high intensity interval training workouts. So, we could do 2 to 3 days a week of full body strength training with a focus on proper form, getting a little bit of rest time between reps, and then breath work integration so that we're tapping into the pelvic floor and deep core as we go. Now, if you're not sure what I mean when I'm saying breath work, tune into episode 5, where I break breath work down further. I talk you through diaphragmatic breathing and how that links up with our parasympathetic nervous system so that we are getting these points of calming our nervous system while also stressing the nervous system as we exercise. It's a really cool interplay. And then this also taps into specifically activating and relaxing your pelvic floor and your deep core. So tune into episode 5 if you have not already to learn more about breath work. Now, if strength training is your main thing, if you love strength training or resistance training, you could do 2 days a week of upper extremity. So for instance, Monday, Wednesday are upper extremity days. 2 days of lower extremity, so Tuesday, Thursday, and then maybe Fridays, your full body, really functional training type of workout. Now, this is also helpful from a metabolic support standpoint. So, we talked earlier about Reds syndrome and how that can a lot of times be tied in with running or those who are doing a lot of HIIT workouts. And this just does not come into play whenever we look at someone who is doing strength training 5 days a week, because there is naturally built in rest breaks within there as we are doing our different sets and reps. And we are pairing a lot of movements with breath. And as we talked about in that breath episode, when you get a good diaphragmatic breath, you tap into your rest and digest portion of your nervous system. So you're getting this neat interplay of the sympathetic nervous system and parasympathetic, all while you're resistance training and getting a really good workout and good sweat in. So that is why, from a metabolic support standpoint and a longevity standpoint, strength training really is gold standard. So this feeds into a healthier hormone cycle, and we just oftentimes don't see that reduction in energy input versus output here. There is a lot of positive research for resistance training as we age and perimenopause and menopause. So when you establish these really good foundations during these reproductive years, it's only going to lead to additional benefit down the road. Next hot take is Pilates. I personally love Pilates, so we can talk about either reformer based or mat based, but either way, Pilates does have a lot of breathwork centered capabilities. And this is similar to the strength training where we get that neat interplay with the nervous system and the pelvic floor and the deep core. Now, if you are somebody who loves Pilates, this can certainly be an aspect of your strength training. Pilates, specifically with the reformer, does a great job implementing resistance from a pull and a push standpoint with the springs and with the cables. And so Pilates can give you the resistance training support that your body needs. We are also getting into a variety of positions during Pilates where maybe you're on your hands and your knees or you're in a kneeling position. And so this is going to put weight through your body in different positions, which is where we see an increase in bone density as well. So absolutely love Pilates. Again, this can kind of tap into the resistance training side of things, and it can also tap into maybe the low impact or more recovery based routine. So this is where personal preference comes in terms of, are you somebody who enjoys going to the gym and having a good lifting routine? Or are you somebody who enjoys Pilates and more that lower load, longer duration type of an intensity? So either way, we can get a really good muscle burn, and it's just kind of picking and choosing what you enjoy the most, because ideally it comes down to, what are you going to do? Right? I can give you all of the research and, what the literature backs as a physical therapist, but if you don't enjoy it, you're not going to do it. And so I know so many women who love Pilates, but then there are some exercise physiologists who have said, well, Pilates doesn't give enough resistance. And my argument to that is, if they're not going to go to a gym and lift weights because that just doesn't feel good to them, My goodness, get the resistance from Pilates, right? We're going to get so much benefit there. So you have to find what you enjoy. A reformer or mat based, where you're incorporating some dumbbells from the comfort of home, can absolutely give you some strength input and resistance input during those Pilates routines. Now, final section, my hot take on would be yoga and more mindful movement or breath based movements. This would include soul core for my Catholic girlies, and this is an often overlooked but missing piece of the puzzle for women who are stuck in that sympathetic overdrive. So, if you're somebody who is stuck in more that cardio and those HIIT workouts, we need to program in mindful movement where we are regulating that nervous system. And so, yoga classes, to my point of Pilates classes doing a good job incorporating breath work, these type of classes are going to restore your nervous system balance, and that is key for hormone harmony and fertility. I love with my clients programming in flows, and I call them mindful movement flows. And in each of my programs, this is specifically indicated for preconception, pregnancy, and postpartum. So if you weren't aware, I have Holistically Well programs specific to each perinatal life season. And the reason I created those was because this particular piece is such a missing link. So many women have a Pilates studio they love, or a high intensity interval training group fitness class they enjoy, or they love training for marathons and half marathons. But so many, myself included, for a long time, have missed this mindful movement piece. And I know that yoga is not for everybody. Soul core, if you're not familiar, is you're doing mindful movement and flows to a rosary. So, those are ways that we can get this mindful movement in, but it's not always done in a way that has a specific look at restoration. And so that is what I created for preconception, focused on supporting the nervous system for that. Pregnancy, where we are specifically supporting the muscles around your pelvis and your core to optimally carry baby. But then I also program in a ton of work where we're opening the pelvis, the pelvic floor muscles to optimally prepare for childbirth. And then postpartum, where we're specifically rehabbing the muscles post delivery. And so this portion, this mindful movement category, we will call it, is key. And in each life season, it will look different. So if you are just generally in these 20s, 30s, 40s age groups, and you're kind of looking for that big picture routine, program this in at least once a week where you're getting really good restorative movement. If you are specifically in preconception, pregnancy, and postpartum meaning really that year and a half post delivery, then I highly recommend my Holistically Well programs. These can be found on my website. You will get specific, just press play, tune in, and you'll have a lot of 20 to 30-minute movement flows. Some are even 10 minutes for those quick hitters, where we can get that nervous system regulation, but also support your body's fascia, your muscle recovery, your breath work. It is just so, so key. So, anyways, a hot take is that you need this and you'll need it to different capacities in these different life seasons. Now, what sometimes people include in this category that I absolutely would not include is stretch classes. So, if you've heard of a stretch lab or a stretch zone where you go and somebody literally stretches you out for you, I do not recommend those, and those classes certainly do not fall into this mindful movement and recovery category. The reason is that this is asking for an injury. When somebody is stretching you for you, they cannot feel that point of tension. They can feel it, but oftentimes they're pushing you past where you should go. And when we have tightness, it's usually for a reason. If there's tightness, it's oftentimes because there is an associated weakness, and we should not just be pushing into it. We're likely creating instability in a system that's craving stability. So all that to say, I recommend avoiding any kind of stretch lab or stretch zone classes. And we want to focus more on dynamic mobility, myofascial release, breath work, really this gentle mobility work. All right. So, big picture, we talked about the importance of strength training, ideally at least 2 to 3 times a week. We want some of that low impact restorative work 1 to 2 times a week. And then cardio, we're filtering in there, not on consecutive days and at an intensity and duration that feels good for you. And we are letting go of the all or nothing mentality of that thought process that we have to be the same like a machine every single day of the week or we're going to fall off track. Instead, I want you to give yourself permission to rest and to adjust your workout routines based off how you are feeling on a weekly basis, whether that's in line with your menstrual cycle or simply how your immune system is feeling that week. And to really move more intuitively based on where you are in your cycle and your capacity overall. Now, here's what I want you to remember from today's episode. Your workout routine should work for you and not against your body. You should not finish a workout feeling depleted. Rather, you should finish your exercise routines feeling energized and good and euphoric, right? We want those really good hormones such as oxytocin released after we exercise and to not just feel absolutely drained. Now, movement is medicine, and I will shout this from the rooftops for as long as I live, but only if it's dosed appropriately. We absolutely can overdo it, especially in these childbearing years. And if you're feeling burned out, bloated, or just hormonally imbalanced and noticing irregular cycles, the answer is not to push harder. It's rather to lean in and find better support for your breath work, for your muscles, and for an exercise routine that is going to support you in this life season. So, if you want a supportive workout plan specific to your life season, if you are in preconception, pregnancy, or postpartum, I highly recommend heading to drkaylaborchers.com where you can learn more about each of these programs. When you join, you get lifetime access. And so you can press play as many times as you want, and you get a number of movement routines to move through. You can also comment learn on my latest post or DM me on Instagram, and I will send the information directly to you. If this episode helped you, please share it with a friend who needs a wiser approach to fitness in this life season because thriving is the new normal, not burnout. Until next time, be well, my friend.